Hello, everyone, and thank you for joining this afternoon. For those of you that don't know who I am, my name is Trish. I have been the annoying person that has been emailing you all and letting you know about InSight. And welcome to this InSight series edition, which is all about an insight into dentistry. And I am joined today by Sean, who is going to tell you all a bit about his career and how he got into dentistry. We're going to start off with Sean, and he's just going to talk through his PowerPoint and share his screen. And then afterwards, we'll take some time to answer some questions. So yeah, over to you, Sean.
Thank you very much, Trish. Hi, everyone. My name's Sean Greaves. I'm a dentist. I'm going to start off with a shortish PowerPoint presentation about the careers in dentistry. I'm a dentist, but I'll be talking about the other professions in dentistry. And then we'll have some questions, and I can answer some questions as we're going along as well that from the chat that Trish might rise. So the hardest bit now is to get the share screen function working. Okay, so dentistry. Basically, it's a dental team that performs dentistry, not just the dentist on its own. And most of you would have gone to the dentist at some time in your life. And you'll know that there's a number of people involved in providing that dentistry to you. You have the dental surgeon or the dentist, he or she. They're always assisted by a dental nurse in surgery. And then sometimes you may see a dental hygienist. Normally this is adults. Children don't generally see hygienists. And they're dealing with the upkeep of the gum health of the patient, instructing them how to clean their teeth and their gums well. And then you have something known as dental therapists. They're doing work which is very similar to a dentist, but basically they have to have a prescription to do it. So they have to have a treatment plan which is created by the dental surgeon, and then they can go off and do certain dental treatments. Then we have a dental technician. Generally, this is a person who doesn't have face-to-face contact with the patient, but they work in the laboratory and they make all of the restorations and prosthesis for the dental surgeon to fit, and they work at some distance away from the dental practice. So that's basically the outline of the dental team. We'll go into the detail. So dental surgeons, let's talk about the training. It's a 5-year program at a dental school anywhere in the UK. I think there may be about 13 dental schools dotted around the UK. From Aberdeen in the north, you have the Southwest Peninsula Dental School down in Plymouth. We've got a few around London, Newcastle. So there's a good geographical spread across the country now. And it's called a Bachelor of Dental Surgery, is generally what you gain after your 5-year training at dental school. It may seem like a long time to commit yourself to, 5 years when you're very young, but it does go very quickly, and then you end up being very old like me. The dentist can offer the full range of treatments. You're trained in all of the general specialities when you're at dental school, from providing checkups to basic fillings, root treatments, crowns, etc. I'll show some of these a bit later. And also salary. Obviously, when you pick a career in life, you want to know how much you're going to earn. So for an NHS dentist working for the National Health Service with their system of payment, you earn between about £33,000 and £87,000 a year. It starts off at 33 during your sort of first post-graduation, which is a sort of probation year called foundation year. Okay, the dental hygienist. This is the professional who looks after what we call periodontal health, gum health. So they do a 3-year training program at a dental school as well, at the same establishment. They gain a Bachelor of Science in Oral Health, or some other title, very similar. They perform the cleaning of teeth. We call it scaling. or root planing. And sometimes this is very deep below the gum, so they'll be using local anaesthetics, so they're trained in the administration of anaesthetic injections. They can polish your teeth. They can apply medicaments to the surface of the tooth, such as topical fluoride, which prevent tooth decay. And some of you may have had fissure sealants, which is a type of, it's similar to a nail varnish that's placed on the surface of your teeth, and this prevents decay in younger patients. They can also take radiographs, x-rays of teeth, and they're trained in that. And generally, they have a salary between 30 and 45,000 per annum. The dental therapist, this can be a standalone 3-year training program. Not sure if it's offered by all dental schools around the country. You get a Bachelor of Science degree at the end of it. You can do all the treatments that a hygienist would be able to do. You can also take impressions of teeth. So if you've had an impression for a mouth guard for sports, you know, what sort of sticky, putty plasticine in your mouth, they do those. I've copied this straight from the internet. Dental fixers, they can do simple fillings on children's teeth and adult teeth. And say if you've lost a crown has fallen off, let's show you those later, they can re-cement those. Dental therapists, they can carry out tooth whitening as well, and they can extract teeth in children's teeth. They can remove stitches from a wound once that's been checked as being okay by the dentist, and they can earn a little bit more, 32 to 45,000. The salaries do vary across the country. The highest salaries are around London. Hygienists can earn £50,000 a year. People obviously like their teeth being clean. I wish I could hear you laugh. Right, dental nurses. Okay, dental nurse training. This is slightly different to the other two in that there's various avenues to become a dental nurse. Generally, it's a 2-year training pathway. So you could be at a dental school once again. It could be at a college. You could have got yourself a job in a dental practice and then be working part-time with day release to the local college to get your certificate in dental nursing. So there's various avenues to do that. You don't have to go to a dental school. Lots of responsibilities for the dental nurse. You know, they're very busy around surgery. Decontamination of equipment is very important for cross-infection, especially with COVID. So they're responsible for that sterilisation process. We have our own sterilisers within dental practices. They maintain the equipment as well. They do equipment checks on the hand pieces, drills, essentially, polishing equipment. They're in charge of the stock and materials in the surgery, so all your filling materials, all of your impression materials, all the medicaments you might use on the teeth, they're responsible for that. And also for patient records as well. Virtually all dental practices run digital record keeping systems. So when the dentist is doing a checkup, the nurse will probably be on the PC in the corner of the dental surgery recording the notes, and then the dentist might annotate a bit later once he's finished the checkup. Salary is about 19 to 25,000, but there is career progression with the dental nurse. So you can become maybe a senior nurse in a dental practice, or you might move on to become the practice administrator. So there's options. The dental technician, this is a laboratory type technician who works usually distant to the dental practice, but some dental practices have their own laboratory technicians on site, so they can do things, custom made and also very quickly. They can have a degree or a diploma depending on where they've trained. Once again, dental schools train them. There might be a few colleges out there as well. Prosthodontic, that's basically dentures, old-fashioned dentures that people used to have a lot of. Conservation, that's a posh word for crowns and bridge work, which they make, and then the dentist will cement them in when he receives them back at the dental practice. Orthodontic technicians, they're involved in making braces, some of the removable braces and custom-made braces. And then we go on to the maxillofacial technicians. These are hospital-based, and they make special prostheses for patients who have undergone head and neck surgery. They may have had a large piece of their maxilla removed, so they can make these type of large prostheses that go in their mouth to refill the parts of bones of their facial structure. And then the last one is clinical technicians. This has been a move within medicine and dentistry to try and get the lowest qualified person to be able to do the job. So you don't really want your dentist who's paid a lot of money to do all the simple work, or medium technical level work. So they developed a course a few years ago where technicians can take impressions as well. So you may see some practices on the street which are denture clinics, and they may not have a dentist at all. They have a dental technician who's been qualified to take impressions. So he can take the impressions of the denture and make the denture himself, and you'll never see a dentist, and that will cut down on the cost of the patient. So dental clinical technicians are out there. They can do, we have one come to my son's local rugby club, and he does all the impressions for the mouth guards and sports guards for school. So there's work, and technicians really, they enjoy that contact with the patient as well, because normally they're distant to the patient. They only receive the impressions. They don't know what the patient looks like, really, what their facial features are. And when you have a technician who can see the patient, they can take the shape, they can look at the patient's face, see the real shape of the crown, the colours, the staining, all the little intricacies, and really get a good job when making these devices to be fitted in the patient's mouth. So that really has come on as a profession as well. So out of those, the various careers, I was searching on the internet, and if you go onto sort of healthcareers.nhs, they have lots of interesting videos of all the different healthcare professions that you might want to look at, have interviews and chats with these people. So even if it's not dentally orientated and you want to be an orthopedic physiotherapist, then there's a video on there for it as well. Okay, day in the life of a dentist. Sometimes a dentist has a drink. Water. Okay, so where do you work? Dentistry in the UK is generally called general dental practice. That's where sort of 85% of the dental work is carried out. And as you can see from these sort of photos I've brought up, and dental practices you may have been to before, they're either converted residential houses, or they might be part of a shop front, or you may get dedicated health practices which have been built quite recently, where old GP practices have been rebuilt, and they try and include a pharmacy, and a dentist may be in there as well, leasing a unit. So there's various places that dentists work within the community. Okay, and your typical dental practice will consist of a reception, where a waiting room shown here on the left, and they'll probably have some tubes of toothpaste trying to sell you to make a bit more money. You've got your dental surgery, and there's two photos there. And this is where the dental nurse, dental hygienist, therapist, dentist will spend most of their day working. You have your dental chair in the middle. Hopefully you can see my pointer moving around. You'll have an X-ray set on the wall for taking your X-rays. General cabinetry containing all of your materials, impressions. Lots of paper cups for the patient to rinse out of. And generally, dentistry is done seating down. The dentist will be on one side, the dental nurse on the other side. If we move over to here, you can see that we have like what's known as a dental trolley that has the handpieces. They're powered by compressed air, so your drill is powered by compressed air, runs about 200,000 RPM. and you use that for preparing the cavities. Your nurse will be on the other side. Because it's a very high-speed drill, it creates a lot of heat, and it's cooled by water. And when you go to the dentist, you end up with a mouthful of water. So you have the nurse there who's aspirating it away, and so it doesn't catch in the back of your mouth. Other things to note, we can see the PC at the back there. So the notes can be recorded. There might be a dental resuscitation emergency kit. It's got adrenaline, oxygen, just in case the patient has an anaphylaxis shock or a faint. These items are known as sharp spins. You get these in all medical settings, so I wouldn't really have them on the floor, but usually you dispose of your needles in there, and then sharp weights which contain contaminated instruments that might only be one use only. We try and use a lot of one use only equipment because it's only used on one patient, and therefore there's no risk of cross infection with a second patient. I think this might be an old X-ray viewer there, but a lot of practices now we've moved over to digital X-rays, so you view your X-rays on computer screen. And most important in a surgery is the clock, because basically you need to keep a move on. You've only got so long with each patient. You've got to keep to your times, because you've got a waiting room over here which has got another patient ready to come in. I've got some little notes saying yes, normally generally 7 to 8 hours a working day. Some dentists work half days. You may share a surgery with somebody and work a long morning. I've known of dental practices, one in Bicester my friend worked at, to try and increase the productivity, because this equipment is all expensive. They do long mornings and long evenings, so somebody might work from 8 in the morning till 2 in the afternoon, and somebody will work from 2 in the afternoon till 8 in the evening. So you can work outside of the general normal working hours. You're assisted by the dental nurses. Average 20 to 30 patients a day. It might sound like a lot, but you might get a family of 4 come in for checkup, so you'll see them relatively quickly. And it's generally the treatments which take a longer time, the fillings, waiting for the anaesthetic to work, the crowns, bridges, root canal treatments, extractions, etc. But sometimes you'll have the patient come in, you'll give them the anaesthetic, because it might take 10 minutes to work, and then the patient would leave the surgery, and then you'd get another patient in for a checkup. So you're always trying to maximise the time that you have during the working day. That's a general surgery routine. You get a lunch break as well. Have a little snack. And this bit at the bottom is it's a strange business how dentists are employed. There's salary dentists who don't generally tend to work. They're quite few and far between. And that would be a dentist who gets a salary no matter how much work he does. He's employed for 37 hours a week. He does his work, or she does her work, and he gets a fixed salary. But generally, the most dentists are what we call associates. So they're like an independent contractor who works for the owner of the dental practice, and they're paid for basically what they do. So, and they'd get a proportion of the revenue they generate. So they'd get about 40 to 45% of what the patient's being charged. So the more patients you see, the more you earn. And that's whether it's private patients or NHS. And the practice owner gets 55%, but then he has to, or she has to pay for the buildings, the upkeep, maintenance of the equipment, the nurses, the reception. So that's where they get practice owners. So most dentists will go through their career and they'll start to think, well, I don't want to just work for somebody else for the rest of my life. I want my own practice. And lots of my friends have gone on to own it, because practice owners have to retire at some point. So then they sell their practice to generally one of the associates who's worked for them for a number of years, and that's how it tends to operate. Salaries, generally the practice owners have higher salaries, they've got more sleepless nights, they've got all the staff to worry about, they've got staff pension schemes, and whenever you employ people and you're looking after staff, you have to deal with their sicknesses and all their problems, so it's an extra burden that they get recompense for. Right, that's my point. Right, treatments provided in the dental practice. Okay, so we've got a list of I've just been talking about there. I'm just going to go through a few photos now to show you what it's all about, if it's all new to you. Okay, so checkups, radiographs. So dentists, in fact, more radiographs are taken in dental practice than in any other aspect of medicine in the country. You know, they take millions of radiographs a year. Generally, this is the radiograph at the bottom is the one you take in the dental practice. It's called a bite wing, which you sort of bite down on it. It's a small X-ray, and it will show you a number of teeth and the tooth you're concerned with. And this tooth that I'm on there, that's obviously the one that's causing some problems. It's lost a lot of bone around it. The patient's probably complaining it's loose. The radiograph above, that's a larger machine would take that. You generally find that in sort of orthodontic practices or practices that do a lot of oral surgeries and tooth removal. They have them at hospitals, but they're commonly found in general high street dental practices as well. And that's an orthopantomograph, and they're good for seeing buried wisdom teeth that haven't come through there. And that's probably why this one was taken. But you'll be trained in the use of that, and your dental nurse will be trained in the use of it as well. My dental nurses are trained in taking radiographs, and they enjoy it because they get to get their hands onto the patient. I can be typing up notes, and they can just go into the surgery and take the radiographs for me, and I could have maybe a cup of tea. Next one, the basic fillings. So a few pictures of fillings here. This is the top one. This is a cavity that's been prepared in a tooth, and there's a sort of a slightly deteriorating white filling in that tooth as well. And this is the photo after. So these are the white filling materials which are based on resins that we use a lot of in dentistry. Here's another photo down here that's had some white fillings. You can just about see the change in colour. So they're just about noticeable in this photograph, but you know, to the normal eye, when they have some saliva on and somebody's smiling, you will not be able to spot this. And then lastly here, we've got a comparison between your metal amalgam filling there and the white filling there. They call it silver. It's a combination of silver, zinc, and mercury that makes this filling. Some countries in the world, the Scandinavian countries, they've stopped using the amalgam fillings basically due to the mercury. It's not the mercury because it's in your body, it's when they're removed and when it then gets into the environment, which is the problem. Not when it's in your tooth, it's very stable. But they are very good fillings, and they've been around for 100 years and they last well. And even the white fillings have problems with them. Because they're resin polymers, people don't know if there's a slight toxicity. Okay, gum disease. This is where the hygienist comes in. A couple of photos here of gum disease. Obviously, this doesn't look too healthy in this patient. And with gum disease, you get a loss of bone around the teeth. This is known as tartar or calculus that you hear referred to. When I started at dental school, I'd never seen this before on a patient. And, you read about it in textbooks. And when you're at dental school training, all of the patients who come to see you have been going to the dental school for years. So they've all got lovely, clean teeth that they look after. So when you get out into the real world, then you see people who don't look after their teeth. And in this case is more mild. and it's just showing the use of a probe. But we put this probe down the side of the gum to see how far it goes down. In healthy people, this won't go down more than about 2 millimeters, but when you have gum disease, you've lost the bone of the gum, you go down 5, 6, 7 millimeters. So that's what gum disease is all about. Hygienists will clean the teeth, educate the patient, and hopefully prevent any gum disease progressing. Okay, on to crowns or caps. Yeah, I think the majority of people don't know what these are. Patients don't. They always say my crown's falling off or my cap, and they haven't got a crown or cap at all. It's just a thing. But basically, it's similar to a bottle top, and it goes on top of the tooth, and it replicates the crown of the tooth, which sticks out of the gum. And these are what the technician will make in his laboratory. And this is a great photo over on the right-hand side. So this is what's left of the tooth. So you can see they're quite destructive. And when the crown's cemented on, a little bit of redness there that will calm down, then it looks identical to a normal tooth. At the bottom, we have known what veneers, and you may have heard of veneers in the sort of cosmetic sort of world. These are essentially like a false fingernail, and they cement onto the front surface of your tooth. Pointer. So they're showing one over here with some calipers. So they're less than 1 millimeter thin. Sometimes you do some preparation, some filing to the front of the teeth, but some of the very thin ones you don't have to do anything. The one problem is they are delicate. When they're bonded onto the teeth, they're much stronger, but they are delicate things. And in the 1930s and 40s, in the American film industry, they used to stick these things on for every set that they were taking of the film, and then they'd fall off about 30 minutes later with some temporary glue. So they've been around for a long time and can get a good result, but not for very hard contact sports. Next thing, root canal treatment. Here's something else that dentists do. Basically, this is when you've had a large filling in a tooth. You've got a large filling down here. The pulp dies off. The inside of your tooth is actually hollow. It's not solid tooth. There's blood vessels and capillaries and nerves inside. And that dies off. It becomes necrotic and full of bacteria. And then they leak out the ends, because the tips of your root is where the blood vessels enter, and then that gets cut off and you get infection. And basically it's a harbour for bacteria, and you've got to clean out the inside of your tooth. And you do it using little files. You come in by the top of the tooth, you clean it out, sterilise it, and you fill it with a rubber material, and then you put a filling back on the top. And the finished article in an X-ray image looks like this. So you have these rubber points that show up on the radiograph, and the large filling. Generally, you'd put a crown on that. So that's root canal treatments. That's something else we do in dentistry, and that can be quite rewarding. And if you like fiddling around with teeth, then that's great. A friend of mine's a specialist in this, a consultant, and he loves it because basically he doesn't have to worry about what the tooth looks like afterwards. He just does the root filling and then sends it back to the other dentist who has to put the crown on, because the patient's only going to complain about what the crown looks like. They're not going to say, oh, I don't like the look of my root filling, because it's inside your gum and they never see it. So that's why he loves it. Endodontics. Okay. Now we're on to extractions. I didn't choose the goriest photos today, not to put you off. So we basically, some people might call pliers, we call forceps. And if you apply some pressure and wiggle your tooth, eventually it will come out depending on the shape of the root. And that's a basic extraction that we do. We're called surgeons because we get up to other things as well. So we can raise flaps of skin. So we can use a scalpel, we can cut the gum, put some incisions, peel back the gum using periosteal elevators. And then depending on the what sort of surgery we've done. We can place sutures in there. And these can be made of various materials, silk to sutures that dissolve, which are man-made. So we do some basic surgery. When we do these flaps, it's generally to remove some bone to assist us taking the tooth out. Okay, orthodontics. This is something that's done in general practice as well. It is a speciality you can go on to do 3 years training in, but there's a lot of systems out there that general practitioners do now because it enhances their income, and it's different, it's nice. We've got the top ones, which are very popular now, Invisalign type tooth straightening, and you just take an impression, send it to the laboratory, and they create these little gum shields for you which straighten teeth. More traditional methods, this one's got the train tracks, but they've got clear ceramic brackets on, which aren't so noticeable compared to the steel brackets. Then we got the traditional steel brackets, and then we got a case of somebody who had some displaced teeth, and they've been straightened. So orthodontics is a rewarding speciality of dentistry, and generally you don't have to put a handpiece and drill teeth, and it's all now we've got implants, and another speciality in dentistry which is taken off. These are more quite big income generators. Orthodontics, I mean, Invisalign can cost £4,000 for a patient, so there's profit to be made in these things. Dentistry is a business. So implants replaces teeth. Basically, it's a screw that you place into the gum. So you're using the surgery skills again to raise a flap and drill it in. Here's a lovely picture of what it looks like, a schematic. Here's somebody who's had one, but it's been placed a little bit high there because when you put the crown on, it's not going to be the same level as that tooth. And this person's got terrible dentition, and basically they've had all of their teeth removed, probably 4 implants put in the top, 4 implants in the bottom, and then they've had these fixed prosthesis dentures screwed onto those implants. So these are like dentures, but they are screwed into their mouth, and that would give a great result for them, considering they look like that. Okay, so I think this said under there was other locations of working in dentistry. So said the majority of dentists and the dental team work in high street practice. Hospitals have dentists in the maxillofacial department where they do the big facial injuries, facial cancers. The maxillofacial consultant is dual qualified in medicine. But you also get senior house officers who are dentists, who've done a couple of years rotations, been around the hospital a bit, and they will do work in the maxillofacial department. And then you get trainees, dental core trainees, those are the DCTs. So that's one place. Community dental services, they used to be called the schools dental service. Community look after those patients in the community who find it difficult to access dental services. They might have special needs, disabilities, educational needs. They might be elderly care homes, etc. So those people, they might be very anxious, different types of medication, various reasons why they need specialist services, and the community dental services will look after them, and they can spend some extra time with them. Dental hospitals, where the majority of the teaching of the dental profession takes place, but they also have departments where people get referred into for specialist care, and also they can get treated by the dental students on their training. Ministry of Defence has dentists who work for them, and I work for the civil service on a salary. And then there's these bodies known as corporate bodies. This goes back to when dentistry started 100 years ago, and only dentists and these institutions known as corporate bodies could do dentistry in the country. But their right to do dentistry has been sold on down the years, and now it's ended up with people like Bupa and Oasis, My Dentist, Roderick, and these are big dental businesses. and you might have seen My Dentists on the high street, and they employ dentists and hygienists, nurses to work for them. But they're very focused on, making a profit because they've got shareholders. Prison, we have dentists in prison as well. I've had friends who've worked in the prison service as dentists, and various people have been providing those dentists, but now it seems to be the community dental service may have provided it, but now the corporate bodies have got in there and they're supplying the contract there because they're basically putting in a cheaper price and driving the cost down. Specialist training. So you do your basic dental training, and then you can go into specialist training. So orthodontics, you do another 3 years and become a specialist in orthodontics. Restorative, you can do various training in, say, crown and bridge work, or endodontics, root canal treatment, or you could become a consultant, and that's 5 years. Periodontics, you can be a specialist in gum health. Maxillofacial surgery, if you want to become the top person in that, then you do a degree in medicine as well. And also dental public health. You might reach a point where you don't want to pick a drill up anymore and you just want to talk about improving the general dental health of the population, just like public health is big with COVID. You have dental public health as well. So you're involved with trying to reduce the sugar in sweets and carbonated drinks in the drinks and food industry, talking about initiatives in school and surgeries and generally in the population. Whoa, there we go.
Thank you so much, Sean. That was really interesting. And as you saw, I was like cringing when you showed some of the photos of like the teeth. And so I thought that was really, really good. We've got a couple of questions, starting off with Isma, who's asked about what GCSEs and A-levels do you need to take and what grades do you need?
Ooh, right. So if we're talking about dentistry, generally they're after 3 A-levels, aren't they? And it's and a couple. You're looking at a couple of A's and a B, or maybe that. It's getting the interview at the dental school, you see, because I'm not too sure how A-levels were going to change. They were trying to move away from this predicted grades and offers, weren't they, about a year ago, and wanted you to be able to apply once you've got your grades. But I'm not sure how that's going. But yeah, it's the standard seems to have been raised over the last few years to the point where you're looking at least a couple of A's and B's in the science. So the definites are biology and chemistry you need, and then another A level with that. But when you get the prospectuses from the university, and you can go online and order one, you'll have every degree of that university in there, or maybe it might be a separate booklet just for the health sciences. Then it will tell you on the page what they're after as their grade. But there's various ways of getting into dentistry. When I apply, I started dentistry when I was 28. So I was an engineer before, and I've got a BTEC in electronics. And so I did an A-level. I did my A-levels part-time, chemistry, did that part-time, got that one. And then because I got the chemistry, then I met a dentist. And I thought, oh, I could go to dentistry. And then I got my biology, studied for that part-time. Basically taught myself, got the A-level there, and then applied. So I only had 2 A-levels when I applied. And I always remember a friend on my course, Lee, he had a BTEC at the time, and he was given an interview, and it was in November, it fell that year, or early December, and it snowed, and they cancelled all the interviews, but he didn't get to hear that the interviews were cancelled. So all the trains were cancelled in Birmingham, and he managed to get to the interview in the snow and turn up when they were cancelled. And they said, I'm sorry, but the interview is cancelled. And they said, well, we'll still interview you because you've turned up. And because he persevered and got there on the day, they offered him a place, And then other people on my course, we had a dental technician. I'm not sure what qualifications he had, but if you're coming in with experience or from another part of the profession or medical profession, I think they look on you a lot more favourably. I've got a friend who was a dental nurse, then she became a dental hygienist, and this summer she became a dentist. So she's gone all the way through. A lot of people in the medical sciences do Bachelor of Medical Science as well. So the guy next to me in the alphabet, he had done a BMed Sci degree, and then he went to do his dentistry. And in America, they all do a pre-degree before they do medicine or dentistry. But generally, for the dentistry, it's going to be about 3 A levels. For hygiene and therapy, it's a couple of A levels. Dental nursing, it's generally about 5 GCSEs. And if you're coming through a practice, it can be two GCSEs. And for the dental technician, I think it's a couple of A levels there as well. But what I would say, and I heard a good quote a few years ago, is perseverance overcomes resistance. And if you keep on knocking at the door, finding out what they want, going away, doing it, keep coming back, keep trying, you will get there eventually.
Persevere, guys. Another question just on the back of that. So Emily's just asked, what is the best way to get into the dental industry? And she's mentioned, would you suggest college or an apprenticeship? Because it's interesting you just mentioned that you did something before you went into dentistry.
Yeah. I mean, when I did it, I remember I wasn't given an interview at Bristol. That's right, Bristol or Cardiff. They were quite age discriminatory then. If you were a certain age, they thought, well, if you hadn't thought about dentistry by now, you obviously weren't interested enough in it. Obviously these days, I think there's no age on the form. They assume you're probably 18, but they can't discriminate you and not give you an interview because of that. But yeah, getting the experience is difficult. I mean, in the old days before Caldecott and these various things for medical inconfidence and things, you could probably, if you knew somebody, you could get into a dental practice or a GP surgery and put it down on your portfolio that you'd had some experience, you'd been there, you'd seen what it was like. But I'd say a good way, with cross-infection now, cross-infections become very, very important, is as well as that part of the dental profession I've talked about, you've also got people who can be just sterilising instruments, and all the people I've talked about have to be GDC, General Dental Council registered. So you have to have gone through a training program to get there, which is difficult. But you could work in the sterilisation, not being trained. So if you could get a job like that, or part-time work sterilising instruments, you could show that you've been, in the medical, in the dental practice sphere, and use that as an experience. Doing the clerical work as well, if you get some as receptionist, even though you're the receptionist, you can say, well, I know about patients, I know what they turn up with, I know how to talk to them, I know how to take what their complaint is, their medical history over the phone, and then pass that information on to the dental team. So there's that way. It's it's contacting practices, contacting people, networking, people you might know who might know somebody else, because sometimes just cold calling doesn't always work. People are always busy, and if they haven't got some type of connection with you, it can be very difficult. I've had friends who are dentists and wanted their children to get into dentistry, and they've asked me if they could come. This was a few years ago before it became more difficult. Could they spend a day at your practice, and that's ultimately how you could get in. I mean, you could even say, look, I'll do some cleaning in your practice if you'll let me have some experience. Because in the evening, the cleaners generally come in and do the cleaning. And I must say, that's just occurred to me now. That's an excellent way to get in. Say, hey, I'll clean your windows, I'll hoover your reception area. If if you allow me to get some experience, so when I go to interview, I know what this is. Or you can just do the progression, start off, do a bit of dental nursing and get on the training pathway. But it used to be so much easier when you didn't have to be registered as a dental nurse. You could just do it. And quite a few 20 years ago, dental students becoming dentists had worked as a dental nurse in a practice, during part-time during their holidays and things, under the coaching of the more senior dental nurses.
And on kind of the back of that, someone else is asking, is it a stressful job?
Oh, yeah, now we're interested. Yeah, the time, depending on how the practice is run, it used to have quite high suicide rates, dentistry. I think it's probably, it was number one for a long time. It's probably 3 or 4, down to 4 now, but you're very time pressured. You've got the demands of the patient. They always, expect a high standard. Different patients are going to have different expectations. Sometimes things don't always go to plan. You think it might be a simple fill-in, ends up half the tooth has disappeared. Ends up, if you're doing a simple extraction, it might end up the tooth breaking, and you're left with just the rooting. And there's a high volume of work coming through. So it can be quite stressful. Yeah, not too many people on. But once you get settled into a good practice and your patient base is quite stable, and you've been there a few years and you know your patients and you know how your nurse works, all these things just make it a lot easier, makes the workflow better, makes your system better, and that would decrease your stress then. It's when you get staff who don't turn up. You might get a locum nurse who comes in and doesn't know where the instruments are in the drawer, doesn't know where the materials are. That make it difficult. But can be stressful.
And another question, just kind of on the back of that, is that do you enjoy being a dentist, and what would you say your highlights?
One thing I say about dentistry, the reason I got into it is very practical. And if you like doing practical things, then that's going to be your day job, for as long as you want it to be. I used to do engineering. I loved doing engineering, fixing things and getting stuck in there. But most professions, as you progress, you're going to go into more man management, more paperwork, sat at a desk. Whereas I thought to myself, dentistry, at least I'm doing something practical with my hands each day. And you've got the element of patience as well. And the majority of patients are very grateful and pleasant, nice. So you get that sort of interaction with different people every day. It can be very, and when you do something nice, you're more excited about it than the patient, and you say to the nurse, you go, God, look at that. Doesn't that look good? And sometimes the patient go, oh yeah, it's okay. Dentists get very fixated on small little things, can bring them lots of enjoyment.
What's the most recently that you've been like, oh my gosh, that was a really cool thing that I did at work today?
Cool thing.
Or exciting, if you want to use different words.
Exciting. Oh my God. I had a crown prep this morning, so I had to prepare. But this person had their tooth crowned and root filled before, and there's a lot of work on this tooth because they'd lost a tooth on the other side. So if they lost this one as well, they're starting to lose too many teeth, and they won't have so many teeth to chew on. And I'd managed to take the crown off, take the filling out, take the root filling out as well on one of the roots, replace the root filling, replace the filling, and then it came back to do the crown. And when I looked at it, I thought, yeah, I've done quite a nice job there. It's going to, my crown now is just going to simply fit over the top, and that's going to be it. So each day you get a good feeling, but then you get some patients and you see them on the day list and you think, oh no, they're coming. I've told them so many times to brush their teeth, and actually I was pleasantly surprised by the one patient this morning, because I thought she's not going to have brushed her teeth, but she actually had made an effort, and they were cleaner than last time. So yeah.
Oh, I feel like, I don't know if anyone else has had this, but I've definitely had the experience of going to dentists and trying to make sure that my teeth is as clean as possible. So
Some patients do.
Experience.
Yeah, some do and some don't.
Final few questions. So we've got one which is back to the interview process, and actually what the interview process is like, and what things might they need to do to prepare for an interview.
Oh gosh, I've heard of it's a long time. I mean, I don't know. I mean, some interview processes, they used to have things like carving, practical skills, but I'm not too sure any of the universities do that, but it's worth looking into. But generally, they're going to ask you why you want to be a dentist, and try and ascertain, your motivation for doing it, how dedicated you are, because it is a long course when you're young, and you've got to stick at it. You've got to be, motivated enough to study hard as well, and you've got to pass the exams, and it costs a lot of money to train a health professional. So they want you to succeed. So generally in medicine, dentistry, the biggest fallout rate will be in the first year. If you can get through the first year, that's the toughest year, you see. So they're going to try and ascertain that. And the only way they can do that is on A-level grades, I suppose. And generally just get out of you why you really want to do it. And if you say, I love talking to people, I like using my hands, I like creating things. They do like that manual creativity, a bit of artistic flair as well. There's a lot of people get into dentistry who've got other artistic talents. I'm not too sure about myself, but a lot of musicians and a lot of people who have done arty things as well. So they don't just want somebody who's purely scientific. You've got to be a bit people person orientated. So if you can get that into your CV as well, that you can chat to people and communicate and listen to their needs and find out what they really want, and diagnosis and rational thought. So I'm just trying to think of what other little other things you could add to your CV that demonstrates the skills of a dentist. So if you Googled the skills required to be a dentist, and then say, well, I can't actually go out and do dentistry because I'm not a dentist, but that skill of listening or note taking, for example, or whatever, or manual dexterity, how can I prove I can do that without actually being a dentist? That makes sense.
Yeah.
Be yourself, be determined, be keen, don't take no for an answer. I know of an anaesthetist, and his daughter went for medicine at one of the London med schools, and she didn't get a place. And he's Egyptian, and he was not happy. And he decided that he was going to take legal action against them because his daughter didn't get a place. And the threat of legal action, all of a sudden his daughter got a place. I mean, what sort of world do we live in? So so I'm just trying to think what other, look smart, look the part. And try and amass as much knowledge about dentistry as well, because they might ask you, things that we've been through today. If you haven't a clue what a crown is, or what a hygienist is, or root fillings, extractions, or any sort of knowledge of dentistry, they're going to question how motivated you are for the profession. And I mean, it's easy if there was lots of students on my course, both of their parents were dentists, and it was a dentist in the family. I didn't know anyone who was dental orientated. I just thought, I met one guy who was, and then it just sowed that seed that I thought, I think. And the other thing is, you're your own boss as well, really. Okay, you might work for a principal, but generally you're deciding what you're doing on a day-to-day basis with those patients. It's not somebody who says, put a filling in there, do this. A therapist might get told what to do there, but as a dentist, so that autonomy I quite enjoyed as well. Whereas in most professions, you've got somebody telling you what to do. Whereas when you're a dentist, you're pretty autonomous in that surgery for your working day. You're deciding whether you need a crown, whatever.
Nice. And final question, if there's one thing that you want like students to take away, those that are thinking about applying for dentistry, what's the one thing, key bit of advice you'd want to pass on to them?
Oh, just persevere. If you really want to do it, try and amass as much knowledge as possible. I mean, the internet's great out there. You could learn so much about dentistry off the internet. You know, all the specialities, what's involved. Some of the textbooks can be a bit confusing because if you haven't got a certain amount of knowledge, it's hard to know what they're talking about. And when you get into medicine and dentistry, they use a lot of technical words that, you know, instead of saying gum disease, we call it periodontitis. You know, everything gets a bit confusing. But yeah, take away, persevere at it. Try and network as much as possible. If you've got a question, then ask somebody, ask as many people as possible, and they might know a dentist. There might be they say you're only 6 people away from somebody else, is it, or something connections in the world. So if you ask 2, you should only be about 2 people away from knowing somebody in the dental professional in the profession. And you can always contact it, even if you're registered with a dental practice as well. Being a member of that practice is going to give you that connection already, because you already go there as a patient. So you've got that connection already where they should be able to help you out some way along there with some kind of experience or knowledge, or sitting in on something, even if it's maybe just a practice meeting. So it's not actually patient facing, so you're not compromising any patient treatment or confidentiality. Even if you could go to a practice meeting and where they discuss things in the practice, or get just a look around the practice when it's closed in the evening, when the cleaning's taking place, all of that's going to give you experience and just that little bit of extra knowledge when you go to the interview.
I love that. Brilliant. Thank you so much, Sean, for joining us this afternoon. It's been such a pleasure. And I don't know how much I'm going to get over those pictures of the teeth. It's scared me to make sure that I don't eat any more powdered sugar sweets ever. Hopefully it's done that for other people. If you do have any other questions and you haven't managed to ask it throughout this time, please, what I'm going to do is I will write up a blog and then send out a link to submit any questions, and then I can always pass them on to Sean. And then
please, Pat, I've enjoyed it. I've been looking at my computer. I haven't seen any faces. But yeah, depending on where you are in the country or wherever, if you've got any sort of questions, then fire them via Trish, and I always get back to you.
Brilliant. Thank you so much, everyone. Have a lovely evening and take care. Bye-bye.
My pleasure. Thank you. Bye.
Bye.